Let's start with the basics of thyroid hormones. The thyroid gland produces two main hormones, T3 and T4. T4 is converted into T3 in the tissues, and T3 is actually the more active form. One key difference is their half-life. T4 lasts about 7 days, whereas T3 lasts around 1 day. This is important because T4 helps maintain stable hormone levels in the body. In terms of structure, hormone production happens in follicles within the thyroid gland. These are lined by follicular cells, contain colloid, and are surrounded by a basement membrane and capillaries. To produce thyroid hormones, iodine is essential. Without iodine, this process cannot occur effectively. An important enzyme here is thyroid peroxidase, which plays a key role in hormone synthesis. The follicular cells produce both the thyroid hormones and a protein called thyroglobulin. Thyroglobulin acts as a scaffold, essentially a structure that supports the formation of T3 and T4. Clinically, iodine deficiency is very important because it can lead to hypothyroidism and goiter, which is an enlargement of the thyroid gland. We also see autoimmune conditions where antibodies target thyroid components like thyroglobulin and thyroid peroxidase. A key example is Hashimoto's disease, where the immune system mistakenly attacks the thyroid gland. Thyroid hormones have widespread effects on the body. They increase the metabolic rate, meaning the body uses more energy. They stimulate protein synthesis, which supports growth and repair. They increase heart rate and cardiac output. They also enhance nervous system activity and increase heat production. So overall, they essentially speed up body processes. Thyroid hormone levels are controlled by the hypothalamus and the anterior pituitary gland. The hypothalamus releases TRH, which stimulates the anterior pituitary to release TSH. TSH then acts on the thyroid gland to produce T3 and T4. This system is known as the hypothalamic pituitary thyroid axis. Once T3 and T4 are produced, they feed back to the brain. They suppress both the hypothalamus and the anterior pituitary, reducing TRH and TSH release. This negative feedback mechanism is essential to keep hormone levels within a normal range. When T3 and T4 levels are high, they strongly suppress TRH and TSH. When levels are low, there is less suppression, so TRH and TSH increase. This allows the body to adjust and maintain balance, a really important concept for exams. We assess thyroid function using blood tests. The key markers we look at are TSH, T3, and T4. These help us determine whether the thyroid is underactive or overactive. Hypothyroidism refers to low levels of thyroid hormones. Patients often present with fatigue, weight gain, dry skin, coarse hair, and hair loss. Fluid retention can also occur, leading to edema. In women, menstrual irregularities are common. In primary hypothyroidism, the problem lies in the thyroid gland itself. Because T3 and T4 are low, there is reduced negative feedback. This causes an increase in TSH levels as the body tries to stimulate the thyroid. The most common cause is Hashimoto's thyroiditis, which is autoimmune. Other causes include iodine deficiency and treatments for hypothyroidism, such as carbimazole. In secondary hypothyroidism, the issue is with the pituitary gland. It fails to produce enough TSH, so the thyroid is not stimulated properly. As a result, TSH, T3, and T4 are all low. Hypothyroidism is the opposite. There are excessive thyroid hormones. Patients may present with anxiety, irritability, heat intolerance, weight loss, and a fast heart rate. They may also have diarrhea and sleep disturbances. In primary hypothyroidism, the thyroid gland is overactive. High T3 and T4 suppress TSH levels. Common causes include Graves' disease, thyroiditis, toxic nodules, and multinodular goiter. In secondary hypothyroidism, the problem is in the pituitary gland. A tumor, such as a pituitary adenoma, produces excess TSH. This overstimulates the thyroid, increasing T3 and T4 levels. This slide is really important for exams. Primary hypothyroidism, low T3 and T4, high TSH. Secondary hypothyroidism, low T3, T4, and TSH. Primary hypothyroidism, high T3 and T4, low TSH. Secondary hypothyroidism, all levels are high. Levothyroxine is used to treat hypothyroidism. It replaces T4. Carbimazole is used in hypothyroidism. It reduces the production of thyroid hormones. If you found this useful, make sure to like